Currently, mainland China is grappling with the spread of multiple viruses, with COVID-19 being the most severe among them. On June 5, China CDC announced that over 440,000 new COVID infections were recorded nationwide in May, with the country still in a high transmission period. According to a June 5th report by CCP state media outlet CNR, Liu Qiyong, a researcher from the Chinese Center for Disease Control and Prevention, stated, "Since March, COVID-19 infections have shown a gradual upward trend, and it is now at the first peak phase of the year." On the same day, the China CDC published a report on the nationwide COVID-19 situation in May. A total of 440,662 new confirmed cases were recorded, including 606 severe cases and 7 deaths. Of the 12,275 valid genome sequences submitted from local cases, all were Omicron variants. The dominant strain was MB18.1, a sixth-generation subvariant of the XDV lineage. This announcement triggered online discussions under hashtags like China CDC responds to rising COVID infections and China has entered the first peak of COVID this year. Netizens commented, "I'm part of that peak group. Tested positive today. Everyone, be cautious." A patient in the next hospital bed came in positive without telling the doctors or nurses. Now the whole room is infected. Both times I tested positive, I just had a runny nose. Every time I get COVID, I feel like I can't even speak without running out of breath. This virus messes up your brain. This is my third time testing positive. I'm afraid I'll get dementia before my grandma does. Fainted at the hospital while getting an IV for COVID. The doctor said my condition was serious and someone had to accompany me. Small COVID spikes are popping up again in many places. I caught it recently. Fever, cough, no sense of smell. It's worse than the first time. COVID never really left. It won't stop in June. Some people are dreaming that it's over. But then bam, they test positive again. Data from the China CDC shows that in week 18, late April to early May, the positive rate for COVID among flu-like cases at Sentinel hospitals rose to 16.2%, more than double the 7.5% recorded in early April. Among hospitalized patients with severe acute respiratory infections, the COVID positive rate increased from 3.3% to 6.3%. COVID ranked first for 3 consecutive weeks among all outpatient flu-like illnesses. It's worth noting that the CCP's official statistics are for reference only. Given the regime's long-standing practice of covering up the truth, the authenticity of these numbers is widely questioned by the public. In the comment sections of related CDC reports, Chinese netizens flooded the space with expressions of despair. "I'm in Guangdong. We're right in the middle of a COVID wave. This time it's lasting too long. It's been almost a month and I'm still not better. Still coughing with phlegm. This round of COVID doesn't come with a fever, just a sore throat, runny nose, cough, and phlegm. Violent coughing gives me a splitting headache. When will this virus finally end?" I know, there are more people dying. A Chinese TikTok creator named Shishi Roye recently posted that her mother died suddenly one morning while drinking soybean porridge. Her head just tilted and she was gone. "Death really comes in an instant," she said. "Since COVID hit, several people around me have died suddenly." Another influencer warned, "COVID can easily lead to heart attacks and myocarditis. The sudden death rate within 3 years increases by 2 to 4 times. In a recent case, a 34-year-old female influencer from Henan suffered a sudden stroke and died after days of emergency care. For months now, COVID-19 infections have been surging in China, and reports of young people dying suddenly have become increasingly common. On June 4, Wang Lujin, ex-husband of the late influencer Haolili, posted a video recounting her final days. "You were unconscious for 3 days and nights. I didn't sleep either. The kids are so young. You can't leave them behind." Wang said they had known each other for 16 years and had not seen each other since their divorce 2 years ago. "I gave everything I had to bring you back. I may not have done it perfectly, but I have a clear conscience." Haolili's last video was posted on May 28. In it, she woke up at 4 a.m. to help her mother harvest wheat. She was drenched in sweat. Her sudden death shocked many. Netizens said, "Strokes are affecting younger and younger people. This is terrifying. My husband knew a 28-year-old who died of a brain hemorrhage. The funeral was yesterday. Why are strokes becoming so common among young people? I always thought they only affected the elderly." Some speculated it may be linked to the COVID vaccine. In recent months, widespread COVID infections have been reported across China. In early May, Even the CCP's official channels admitted to the rising wave. At the same time, more cases of sudden death among young people surfaced. On June 1, a 48-year-old influencer from Jiangxi, Duan Yu, died of a sudden brain hemorrhage. Online sources also revealed that schools in cities like Guangzhou, Shaanxi, and Jiangsu have even instructed students to stay home or go into isolation. Citizens in many regions told New Tang Dynasty TV that hospitals are overwhelmed again. Entire families are catching the virus, young and old alike, and sudden deaths are shockingly frequent. On May 29, a resident of Jilin, surname Tao, said, "A lot of people have died, 3 or 4 in just the past couple of days. No one knows what they died from. Some were old, but some were young too. They seemed fine, and then suddenly they were gone." On May 30, the owner of a clinic in Hohhot, Inner Mongolia, Mr. Liu, stated that there's been a surge in patients, all testing positive for COVID. Many show prolonged symptoms lasting several months. Based on how infectious diseases behave, we might see a sharp spike in June or July, Li warned. There will be many severe cases, but news won't be easy to get. Sudden deaths in people around age 50 are quite common. Even those in their 30s are affected. It's often due to heart attacks, strokes, or brain hemorrhages, and this is definitely related to COVID. It weakens the immune system and attacks your body's weak spots, causing rapid deterioration. A Chinese TikTok account named Director Lang of Chinese Medicine posted a video claiming that after the May Day holiday, COVID came back again. When one person falls ill, the whole family gets it. He described the symptoms. When it's bad, it feels like your throat is roasting on a grill. You can't even speak. Meanwhile, large volumes of user-generated reports have appeared across Chinese social media platforms. Schools in Guangdong, Shaanxi, and Jiangsu are suspending classes or forcing students into isolation due to COVID outbreaks. However, given the CCP's heavy censorship, what leaks out online is likely just the tip of the iceberg.